had a C-section. I had both. I had vaginal and a C-section, unfortunately. I thought I earned myself a great second delivery, but my daughter was breech. And I pushed for 3 hours the first time around. So I've had the best of both worlds. Actually, the worst of both.
Yeah.
I don't think people understand. Like,
No.
C-section is a major abdominal surgery.
It is.
You get surgery and there's no sleep. You don't get recovery
Correct,
time. They put the baby right on your boob 2 hours later. You're like, okay, you still can't feel your legs. And then the next day, it's like your body cannot heal. There's no downtime from that.
Yeah. Hello, everybody, and thanks again for joining us for our part 2 with physical therapist Chip Yamaguchi. And on this next episode, we're going to be talking about a very interesting topic that actually I've never really even thought about, but it's how should I say, physical therapy concerns or issues following childbirth or C-section. So thanks again for continuing to have this discussion with us. But our next discussion topic is childbirth, C-sections, and some of the problems that are associated with that regarding physical function.
Yeah, that, and I have some questions about almost like a follow-up from Dr. Kessel's talk about hormones and the effects on the musculoskeletal system.
Did you like that talk? Isn't he great? It's so great.
I thought it was really interesting.
It's super interesting. And things that we all go through, but we really don't think about,
Well, I think, it is something that we don't talk about for women.
We don't talk about it.
And we don't talk about it for men as well.
That's true, actually.
Men's, declining testosterone levels. And
they go through hormonal changes as well.
Yeah, so hopefully, and I know I'm already at that age where, where things are, obviously not as good as it was before.
Oh.
So, that'll be another topic for another day. But let's go ahead and start our questions about.
I'm super interested because I had a C-section.
Yeah.
So I had both. I had vaginal and a C-section, unfortunately. Yeah. I thought I earned myself a great second delivery. But my daughter was breech second time around. And I pushed for 3 hours the first time around. So I've had the best of both worlds.
Oh, okay.
Actually, the worst of both.
Yeah.
Did they try to, what do you guys call it? External manipulation, turn the baby?
That is something that we offer.
What is the name of that? There's a name of the doctor who did that, right?
It's called external cephalic version.
No, but isn't there a mnemonic? I mean, not a mnemonic, but you know how they have a name like the Houston maneuver or whatever? You're like, isn't there? Or am I misremembering that?
We have ECV, which is basically like massaging or loming the baby head up to head down.
Okay.
Does that actually work?
It's 50-50.
Wow, that's pretty good, actually.
Sometimes it works, sometimes it doesn't.
I thought there was a doctor's name associated with that move.
With the ECV?
Yeah, maybe I'm wrong though, because orthopedic, we have all these names associated with, like Tommy John surgery, right? Do you know what I'm saying? We have all of
names.
these, the names of the surgeons who, did that procedure, right?
Yeah.
Anyway.
They do offer ECV. If you want to do that, sometimes we do it in the hospital because it can be painful. So sometimes they'll offer you a hospital ECV where they'll give you some analgesia, and then we can.
What does ECV stand for again?
External cephalic version. So it's
And that
basically loming the baby down, head down.
It's massaging a breech baby.
They call it a massage, but it's actually is pretty painful.
Okay, so it's an uncomfortable massage.
It's an uncomfortable massage.
That they're literally trying to force the baby into the head down position by pushing on it while it's in the uterus. Oh man, that does sound painful. Yeah.
And it comes with its risks, right?
Yeah,
so some people will opt for it, and some people, if you've had 5 kids and then all of a sudden this one and your 6th time you have a pretty good chance that the baby's not too big and you have enough fluid in there.
And the uterus is looser.
Babies hopefully will go down with those, but like if it's your second one and you don't have a lot of fluid in there and the baby's kind of chunky, it's less likely to be.
Yeah.
I don't know. I feel like OBGYNs, because we've seen all the worst things happen, sometimes we don't opt for those things. But there's other things to do too that are, I don't know, kind of midwifey things, and midwives' tales kind of things where you can put cold, like peas and other things on, like to kind of get the baby down. There's also this thing called spinning technique where you can like lie upside down or like on a ironing board and try to manipulate gravity to have baby turn. There's all kinds of stuff that people try. I've tried it all. Moxibustion.
What is that?
Have you heard of moxibustion?
No, what's that?
Where you like put I don't know what it is. It's like this stick in between your toes, and they light it on fire, and it's supposed to, I don't know, it's this old thing. Tried that too. I tried moxibustion. It didn't work, but sometimes it does, I hear. It's kind of, yeah. But there's all kinds of stuff. But I opted not to. I just opted for the C-section.
I can see why.
I was just like, nope, it is what it is.
So the question here is, with the C-section and the disruption of the abdominal muscles, does it put you at increased risk for
low back pain
low back
in the
pain
future?
In the future.
Right. And then, if you develop, it's not like you're going to have back pain right away all the time. Say you develop it 5-10 years. There's this disconnect because it's been so much time,
Yes.
right? So you don't realize, oh man, I guess maybe my C-section did affect my low back pain, right?
I think anything that disrupts your core, whether it be C-section or GYN surgeries or oncology surgeries, I think anything in the abdomen would kind of affect.
And the other thing, right, is so obviously when a woman is pregnant, right, and as her abdomen gets bigger and bigger, the fluid and the baby in there basically is like a weight belt. It provides pressure to stabilize the back.
Yes.
So, and then I don't know, whenever the relaxin hormone starts to kick in, is that the last trimester?
Yeah, this one is, actually, no, they say it's, relaxin is actually made by the corpus luteum early in pregnancy. So it peaks at 6 to 10 weeks. And then relaxin kind of declines after 14-ish weeks. And then it falls pretty quickly after delivery.
Oh, okay.
Yeah.
Because
it's made by the corpus luteum and then kind of transfers to the placenta.
Sorry, what is the corpus luteum? Sorry, you remind the orthopedic surgeon.
So,
is that in the uterus or?
No.
What
So
is
the
it?
corpus luteum is the yellow body. It's, let me get you a correct definition.
But that's
of it.
part of the fetus.
No.
No.
It is in your ovary. So the corpus luteum is a structure that develops in the ovary after an ovum or an egg has been discharged, but it degenerates after a few days.
Got it. And
unless the pregnancy has begun.
produces the relaxin.
Yes. Until the placenta is mature enough
Got
to
it.
start producing relaxin.
So for the audience,
From what I know, I don't know. I'm not an endocrinologist.
No.
So
But the relaxin, just for the audience, right, is a hormone or
It's a peptide.
It's a peptide in the body that is
Hormone.
thought to soften and relax the cartilaginous tissues that hold your bones together. And the reason this is important is because obviously when you're pregnant and the baby has to come through your pelvis, you want the joints, so to speak, to be a little
To be
bit
relaxed.
flexible so that it'll stretch to accommodate the baby's head and body coming through the birth canal. And then later on, hopefully we'll get, but your question about the relaxin is because if the joints between the pelvis and all of these cartilaginous structures that are generally very, very tough become softer
Looser.
and more lax, it can lead to some musculoskeletal symptoms that, maybe are not so well defined.
Yeah, and so, during the period where the woman is pregnant, right, and then the fluid and the baby are creating some stability for the body.
Yep.
And then the woman gives birth, and then you lose all that
Pressure.
intra-abdominal pressure
Yes.
on a very relatively deconditioned woman,
Yes.
right? Because she's obviously been
we were
She's been
just talking
pregnant.
about
less
that.
active than
Yeah.
she was prior to being pregnant.
At
right?
least in the last
different way.
trimester. I've noticed that women in the last trimester, they get really big.
Yeah.
Right? They
Yeah.
get big from the first 6 months or whatever. And so obviously they're not lifting. I mean,
Yeah.
some women do.
Yeah.
Hats off to those women that still
Oh, there's
exercise.
some marathoners.
Oh yeah.
Yeah.
And those people, they just bounce back. I've seen they just bounce back from pregnancy. Yeah.
Amazing.
We had one of my PAs was pregnant during work, and she was obviously in great shape. And man, she was also Chinese, so maybe Chinese women are really super tough. That's why there are a billion Chinese, right? You know what I mean? But anyway, she just like gave birth and then like back in work and like, just so tough, right? Like, you know what I mean? Like nothing happened, but she kept herself in good shape. Right?
Yeah.
So people would always remark like, "Oh my God, you just gave birth and you look like nothing happened," right?
Yeah.
She just
Yeah.
But like
genetics,
everything
but-
changes when your whole anatomy, your posture,
Yeah.
right? Doesn't your spine? It's very.
gets more curved.
It gets more curved because of the weight. And
You have to lean backwards a little bit more, and then
Yep.
and the thing when you actually then
the pelvis is.
when a woman gives birth, right? Now the work begins because
Yeah.
you're constantly bending over and picking up this baby and reaching into the crib and
I don't think
on-
people understand. Like,
No.
C-section is a major abdominal surgery.
It is.
And
Yeah.
you get surgery and there's no sleep. You don't get recovery
Correct, yeah.
time. They put the baby right on your boob 2 hours later. You're like, okay, you still can't feel your legs. And then the next day, it's like your body cannot heal. There's no downtime from that.
Yeah.
And I'm not sure how long the relaxin drops off pretty quick.
Pretty quickly, they said.
Yeah.
Mm-hmm.
But you're right though. In that time period, your core is completely stretched out and right.
I would, yeah. I mean, even for the woman who hasn't had a C-section, right?
Yeah.
Is kind of set up to have
That's
problems.
right.
And then you introduce a C-section, and then you're cutting through the abdominal wall, and and disrupting potentially the whole stabilization system, right? And then so I've always wondered that is if routinely why women are not sent, even if it's only a short course of therapy, to say, look, you can do these exercises, on this, and you can progress at this rate or whatever, right? So,
It would be very helpful to have physical therapy after a C-section. I just don't think, number one, got to be insurance, right? Like that's a big barrier. Who's gonna pay for women having physical therapy?
Yeah.
They don't pay for even 6 weeks maternity leave, right? That's 6 to 8 weeks maternity leave. That's what women get. And then after that, could you imagine paying for insurance companies to pay for physical therapy for women? I don't think that they find that valuable, although it would be extremely valuable.
well, any kind of pain or functional deficit
Yeah.
will be pretty easily covered by insurance, I would think. But the old thing, right, is that it's been done this way forever. Like
Well, also, right, women are just expected to kind of suck it up.
I have heard that response from some physicians that back pain is just part of pregnancy.
Right.
And
Yeah.
that's just how it is.
Yeah.
Right?
It is
So-
the most uncomfortable feeling ever to be pregnant. There's a lot of women that, do really well, but the majority of women, it's very uncomfortable. Pregnancy in general. And then postpartum, you're sleep deprived, you don't feel well, you're bleeding from everywhere, you're breastfeeding, and then you're expected to, heal. It's very difficult for women, but we don't really say anything,
It's amazing how women recover from C-sections.
It's amazing.
If men had to do
There's
that,
no man would ever.
Yeah, we would go extinct.
Yeah. And to
Yeah.
think you get just an extra 2 weeks for if you have a C-section
Yeah.
versus a vaginal delivery. Sometimes even vaginal delivery though, the outcome of that, you're like, man, maybe a C-section would have been better because there are certain vaginal deliveries that can go really, really rough, and have a lot of postpartum problems after that. 3rd and 4th degree tears, things like that, where you have anal incontinence. There's certain things.
You guys have it rough.
Yeah, it's not fun. It is not fun.
But at least, with a C-section, they let you stay in the hospital for another day.
One more day.
Ooh.
Woohoo. Woohoo.
Yeah.
Yeah. And, these days they don't give you any, which is great because, it has its own problems, but it's just Tylenol and Motrin. That's all you get after a C-section. That's all you get. You don't get any narcotics.
Yeah.
Nothing more than Tylenol and Motrin. Same as if you sprain an ankle, right? So to me, it's just very interesting how
I need
women
to
are
find
treated.
the one patient, a woman who's had a C-section, rotator cuff repair,
Oh.
a hip replacement, and a knee replacement, and to have them rank.
The pain.
Yeah.
Everybody somebody always asks me what was worse, vaginal or C-section. I say both are bad. Both are rough.
But recovery
very
is
different
faster
ways.
with vaginal birth, correct?
It is faster, but you do have other things that happen. Like, God forbid, a sneeze comes out of nowhere after a vaginal delivery. You're leaking everywhere. Sorry, TMI. But she just comes right out, you know? So, whereas C-section, you don't necessarily have those problems, but you have other problems, right? So,
it's amazing to me too. Is it true, right, that when you perform a C-section, how fast can you get to the baby?
usually under a minute. So if they're
And how long does it take to actually put everything together?
Depends. There's certain surgeons that are faster, and there's certain surgeons. It depends on kind of your idea and philosophy of it. We've had kind of old school surgeons who their belief is you repair every layer that you've disrupted, and then there's some evidence now that you don't need to repair
I never
every
knew
single
that
layer.
all of that wasn't put back exactly how it's supposed to be.
No. I mean, there's different thoughts and some evidence on each layer whether or not it needs to be repaired or should be repaired. That's another great topic, though. But yeah, not every layer needs to be repaired necessarily. And then as far as scar tissue is concerned, we don't have a lot of great like adhesion barriers or adhesion prevention during the C-section. So we don't really have, there's certain things that we use called like Sepra film, but the evidence really isn't there that it helps with adhesions or scar tissue. We don't really have some great things to use to prevent a lot of scarring.
So, I was just looking up a little bit on the C-section thing, and they were saying that the incidence of back pain following C-sections was significantly higher for women, than vaginal birth, at least according
Is
to
that
one
like
study.
immediate back pain or
Yeah,
that's
but
like
this is
far out?
This is short-term back pain.
Short-term.
So in the immediate period, right? Like it said, it was like something like 44% back pain with C-sections versus 30% with vaginal delivery. So not actually 10% difference is not tremendously greater, but I think the question of long-term.
Yeah.
Long-term is it?
Long-term, I don't know if anybody's really studied that.
Because, short term, my back was probably more sore with the vaginal delivery and pushing for that long. And the baby, if they're, sunny side up, putting pressure on your back, it's really painful.
Yeah, they also said that, there's other contributing factors, right? Like spinal or epidural anesthesia, incidence of back pain is higher, So, I don't know.
Oh, spinal versus epidural.
Spinal or, there's women with spinal or epidural anesthesia tended to have more back pain as well. So those are some of the contributing factors, right? Yeah. They talk about postural strain, but it's all short-term studies on the incidence of back pain. But I think your question about the long-term, like these women are now 70, they've had 2 or 3 C-sections, right? Or even just one. If the surgeon didn't repair the rectus or that's such an interesting question.
Well, not only that, but that's whatever you're reading, and they talk about short-term back pain. That's probably defined as someone who had back pain and then it goes away, obviously.
Yes.
But it doesn't actually necessarily answer, did the back pain return later?
Yes, that's what I'm saying. So like
Right?
the long term, so like, if somebody were to design a study that, interviewed 70 or 80-year-old women, right, who had back pain, clinically significant back pain, and then you ask them, I don't know if anybody's really done that study, right? Plus, to find the records of when they were 30 years old
I think it's
or
just
20
so
years
hard
old,
to
it's
like
hard to
pin
keep
it
track.
down to
Yes, it is
just that.
very, very
versus-
difficult. But from a logical anatomic standpoint, it makes a lot of sense.
Yeah.
It would
it
be
does.
like your core was
It does.
cut.
Yeah.
And if it wasn't repaired, or even if it's scar tissue is not the same as a healthy fascial attack. You know what I mean?
Yeah.
Scar tissue is not as strong as normal tissue. People think that scar tissue is extra thick, but it's not normal.
Yeah, when it comes to back pain, you can ask 10 different therapists, and 10 different therapists are going to have their top reason as to why people get back pain. Personally, a wise therapist once told me that joints that are relatively loose or move around an incorrect axis of motion produce pain. Tight joints generally do not, particularly in the spine. So when you start interrupting the whole fascial system and stabilization, I can see how people have hypermobility in their back, and then they have chronic back pain from that.
Yeah. Well, that's why surgical treatment is fusion.
Yeah.
Right.
Yeah.
I'm probably saying that incorrectly because there's more reasons for the fusion. Meaning they're trying to give you more space for your nerves, et cetera, et cetera. But it's usually the joint above or below, if I'm not mistaken, and that starts to cause pain because now you have a stiff joint, and then the joint above is relatively hypermobile.
Yeah.
So, I don't know if this makes a difference, but they do say that most studies do not find a strong link between C-section and chronic back pain when controlling for other factors such as age, weight, parity, pre-existing back pain, and physical activity. But it would make sense if they did have.
But I think the other thing too is it is extremely difficult to isolate.
It's extremely difficult,
right? Because it is so multifactorial that it is very, very difficult to have a study that's going to show you that is. But very interesting, thought-provoking question.
It is, but I do think that it has a lot more to do with like weight, obesity, the amount of scarring that's in there,
lifetime exercise,
lifetime, and it's interesting when we go into an abdomen. It doesn't really matter. It's very individualized. Like if I go in for a repeat C-section number 2, that could be the worst scarring ever. And then I go into a repeat C-section number 5, and it's beautiful. Yeah. So you can never tell who's going to heal how.
Yeah, and I think that's another thing that patients don't understand is that there's a lot of genetic, genetic differences with people.
Yes.
How does the body heal? Are you a real big scar developer?
Right.
Are you not a scar developer?
And people associate their outward scar with how they heal inside, and they have no correlation.
Absolutely true. So I think a lot of our patients will say, "Oh, you did such a good job. The scar looks so good." And
right.
I was, it always. I mean, it's funny, but they have no idea that that has nothing to do with what's going on the inside. Yeah.
Mm-hmm. So you can heal beautifully on the outside, and I get in there and it's just cement.
Yeah.
And you're like, oh my goodness, I didn't anticipate this bad of scarring.
Yeah.
But I've had it where my worst C-section ever was a number 3. And usually number 3, not too bad. You get some scarring in there, but it was absolutely,
interesting. Any other questions or observations about post-GYN or birth?
Not specifically about childbirth, but I do have to kind of switch gears, if you don't mind. I wanted to get your thoughts on, when you guys were talking to Dr. Kessel and you guys brought up the average age of menopause, which was 51 or 52, correct?
Correct.
And then he said that in terms of perimenopause, right, hormone levels can be all over the place.
All over.
Okay, so it's pretty widely accepted and known, right, that people who get tight shoulders or frozen shoulders just out of the blue, typically are women in their menopause years, right? So whenever you try to do like a little search and find out the reason why, I've never found a specific reason why. So I don't know if when, it's estrogen levels that drop, right? What is the correlation? Do you have any thoughts on why that's
So I think, again, it's probably multifactorial. So not just one thing, and everything's kind of going a little nutty. But we did find some studies that showed like estrogen helps regulate collagen turnover and joint elasticity, maybe.
That's interesting.
So maybe that's why. And just with low estrogen and menopause in the age, you have increased like fibrosis and reduced capsule elasticity. I'm not sure. And then also your inflammatory responses are different, I think, during that whole peri and menopausal kind of time. So I don't know. They think that menopause actually puts you, and I'm not sure about this, in a very low inflammatory state.
A low inflammatory state?
That's what they say. Menopause is associated with a low-grade inflammatory state. And so it's just
higher
metabolically.
Than baseline?
I don't know. These are just all like,
Sure. theories or thoughts. Yeah.
and thoughts about why this
But
might happen.
Your other question you asked about is frozen shoulder more common after menopause, and it is associated with it.
Yeah, because
But I don't think they have one reason.
Yeah, but for some reason,
Necessarily why.
and it might be just an age thing too, right? Like,
yeah, because I tell you, like right now, probably 90% of my day is seeing shoulder patients.
Really? That many?
Yeah.
Wow.
And
All menopausal age?
lots. Right? It's the same thing, but, back in the day.
What is a frozen shoulder though? Like what?
is when your capsule gets tight or it's painful. So what happens is people start having shoulder pain.
Yeah.
And then it's from inflammation, right? And then because it's sore, they stop moving it.
Yeah.
So then.
Oh, but it's not like an arthritis.
It can
necessarily.
be caused by arthritis or anything that causes some kind of inflammation in the joint.
But basically, it's inactivity that causes it to be frozen.
What happens is your response to it, right? People get sore shoulder.
Yeah.
Then they don't want to, that hurts, so they stop moving it. So pretty soon it's going to get tighter and tighter because they stop moving it to the points where.
Like a stiff neck.
So actually, the treatment is stretching.
Oh.
You have to actually, stretch it. And anyway, we'll have Dr. Weldon on one day and talk about that because it's that's a super common interest top with a very, very simple but simple solution of stretching, but you got to be diligent.
Yeah.
Yeah. But
do you find it like most of them recover?
Most do.
Oh.
Sometimes it's harder than others. Occasionally, I know that I'll ask, like, Dr. Weldon what his thoughts are on, is this person a candidate for manipulation under anesthesia? And so sometimes
I think you're right, though. I think it just more has to do with kind of maybe age.
Well, this is saying that the peak incidence of frozen shoulder occurs around age 55, and this is in both men and women.
Both men and women. That's important.
That's both
But
men and
if
women,
I see a guy who's say his late 40s, 50s,
Yeah.
come in with a frozen shoulder for no reason at all, my first question is, do you have diabetes?
Oh.
And almost always they do.
Yeah.
Yeah, diabetes is definitely.
Yeah.
Yeah, but the mechanism, I'm not sure. I would have to look that up and see.
But when women are in their perimenopausal, menopausal years, it takes very little for some to push them over the edge to get a frozen shoulder. Like I've seen during the pandemic, say you get the vaccination, it kind of hurts your deltoid. Yeah, they don't move it, boom,
Yeah.
frozen shoulder.
Really?
They
That
say-
quick?
Oh yeah,
Wow.
real quick. Or I'm working from home now, frozen shoulder because they're not getting dressed, brushing their hair, opening doors, driving, right?
Yeah.
Decreased activity, boom, frozen shoulder.
So
Yeah.
this here says statistically, patients with diabetes on a meta-analysis of 13 studies, almost 4 times more likely
Yeah.
to have
Says
frozen
shoulder is more
shoulders.
common in people with diabetes.
Yeah.
So
But it also says here that postmenopausal women often experience changes in insulin insensitivity and lipid metabolism when they're older too. So maybe that has some sort of
yeah,
weird link, but I don't know.
I think the principle or the how should I say the universal truth is that aging is associated with a lot of bad
A
stuff,
lot of bad stuff.
right?
Don't get old
Yeah,
and
Yeah.
keep moving, like
you
you
gotta
said.
keep moving. Yep. And the only way you can combat all of these things, as we've said before, is exercise.
Exercise.
That's the only thing you can do. You cannot control your genetics. You cannot change aging. But the one thing you can do is try to exercise, right? Even diet. We don't know much about diet.
Yeah.
Maybe one day we'll have a nutritionist on here. Nutritionist. That's right. I forgot about that.
I have my master's in nutrition.
That's right. But
But I'm not a nutritionist, so
Yeah.
they're amazing. And
Practicing,
let's get
But we should
an
get
expert.
a nutritionist. But even though there's really no, as far as I know,
Yeah.
there's no studies that tell me if you eat more asparagus, you're going to have less
Well, I
likely,
mean-
But
Nutrition is a preventative.
yeah, but a healthy, balanced diet, I would say.
It's great.
Right?
Yes, very important.
Yeah. So it's just, like I said, we don't know the specifics of it. But, trying not to eat McDonald's every day or I shouldn't
sure.
even say that because, that's probably, not that there's anything bad about McDonald's.
We'll
but-
edit that out.
Yeah. But, you basically try to.
We love McDonald's.
Yeah, I love McDonald's too. But, try to do it once in a while.
Right,
if you're
just
eating it
moderation.
moderation.
That's my
exactly.
whole theme. You
Which is
have
what
a piece of
Dr.
candy, go
Yazawa
ahead.
and Dr.
Right.
Price said, right? everything in moderation.
Everything in moderation.
You know, it's okay to drink a beer once in a while.
Have it.
12 beers a day, maybe not so
Not
good.
so good.
Yeah, you know?
Not so good. Yeah.
Yeah. But anyway.
Okay.
Anyway, I don't know. Do you have any other? You know, those are good questions.
No, that's those are the main ones.
Okay, well, anyway, I don't know why. We have scary things going on with Alexa or whatever. So we'll cut here.
We have cats. We have snoring dogs.
And
we have
ghosts affecting our speakers in the house.
It's amazing.
But anyway, Chip, thanks a lot for being with us
Thank you
here.
so
Thanks for
much.
having me.
Hopefully, that was a really interesting discussion for those two topics on OBGYN considerations and physical therapy issues, et cetera. So,
well, thank you for joining us from the inside out.
And I think that beeping is our cue that we need to close
leave.
here.
Yes.
Yep.
We
So
are
anyway,
ready to go.
again, if you can like and describe, that'll be very helpful.
Please take care of each other. Aloha kikahi, and take care of each other from the inside out. Thank you.
Goodbye.
Good job, guys.
What in the world?
What is that?
What is that?